Maya Warrington, and I'm a nursing student at the University of South Alabama, and I will be performing wet to dry dressing change. And here is my nursing ID. Upon entering the room, I'm going to identify the order and the hospital policies, as well as making sure I have all of my equipment. I will then perform hand hygiene. I will then identify the patient. Jaguar Jones, date of birth August 25th, 1963, MR number 417-6352, and he is allergic to penicillin. I will then explain to my patient the procedure I'll be performing on him today while maintaining privacy. I will then get my trash can and bring it to my work area and perform hand hygiene with the antiseptic hand rub. I will then heighten the bed to a working height and lower the side rails, as well as positioning the patient to a comfortable position. I will then apply my gloves and my goggles. I will then expose the dressing, as well as maintaining privacy. I will then remove the ABD pad, taking the tape off towards the wound. I will hold the ABD pad up and away from the patient. I will then assess the drainage on the ABD pad for the type, the amount, the color, the consistency, and the odor. I will then remove the inner packaging. I will then assess the wound for the size of it, the inner tissue, whether it's granulation, necrotic, slough, or odor, and I will palpate around the wound for any redness, edema, or tenderness the patient might have. And then I will ball up the ABD pad and remove the gloves above the trash can, facing downward, glove to glove, skin to skin. I will then perform my sterile field. I will grab my sterile field. The 1-inch border is contaminated, and anything hanging off is contaminated as well. I will then dump the new packaging on the center of the sterile field. I will then grab my saline bottle and check the expiration date, and then I will palm the saline label, taking the lid off, facing it upward while pouring the saline in without splashing or touching the edge of the tray. I will then put on my sterile gloves. I will take my non-dominant hand and grab the outer cuff to place the glove onto my hand. And I will take, with my thumb facing outward, go on the inner cuff and apply this glove. I will then organize my equipment. I will place 5 pieces of gauze in the saline without touching the outer edges of the tray. I will then assess the suture for the size, the approximation of the edges, and for drainage. I will then begin cleaning the suture. I will squeeze out any saline from the gauze, and I will clean from the least contaminated to the most contaminated, starting in the middle, and drop the gauze in the trash can, and then I will repeat this onto the right side. And dispose of that. And then I will do the same process onto the left side, draining all the water out of the gauze. Making sure my gloves do not touch the skin. I will then take a dry piece of gauze to lightly pat any excess saline on the suture. And dispose of that. I will then pack the suture. I will strain the gauze first, and I will fluff it out. And drop it in the wound without touching the edges of it. And I will repeat this process again by draining any saline out of the gauze and fluffing it. And dropping it in the wound without touching any of the edges. I will then grab a 4x4 dry piece of gauze and place above the wound. And I'll then grab the ABD pad and place it above that. I will then remove my sterile gloves. Doing glove to glove, skin to skin. I will then grab my tape and measure the sides of the ABD pad. Once applying the tape on the ABD pad, I will grab another piece of tape to place on top of it with my initials, the date, the time of the wound procedure. I will then cover my patient back up, lower the bed, and raise the side rail. I will then perform hand hygiene and dispose of my sterile field. I will then go to the nurse's station and document points on the wound, the suture line, and how the patient tolerated the procedure.